A U.S. government advisory panel endorsed widespread use of Pfizer's coronavirus vaccine Thursday, putting the country just one step away from launching an epic vaccination campaign against the outbreak that has killed close to 300,000 Americans. Approval could come as early as tonight. Frontline healthcare workers and residents of long-term care facilities could start getting vaccinated against COVID-19 next week. Pfizer, the vaccine's manufacturer, plans to ship around 2.9 million doses in the first weeks. The nation's top infectious disease expert, Dr. Anthony Fauci, is reaching out to African Americans, telling them the COVID-19 vaccine is safe. A recent survey by the COVID Collaborative, an organization aimed at ending the pandemic, found that only 18% of Black Americans completely trust the new vaccine. Aaron Simonak has been speaking to Black leaders in the areas of public health and policy about the roots of this mistrust and why it's so important that the state works to overcome it. Good evening.
Good evening, Derek. Experts I spoke with say this mistrust in this vaccine for minority communities requires extreme outreach efforts on vaccine education. And in fact, without minority communities taking this vaccine, it's safe to say the virus still won't be controlled, and say this new initiative by the state comes not a moment too soon. With a long-awaited COVID-19 vaccine potentially coming out within the next few days, local minority leaders say there's a major roadblock in the way for underserved communities, and that's mistrust in the vaccine.
When you have a vaccine and you have a disease where minorities have disproportionately been represented, there's certainly some mistrust when you see a vaccine that's sort of been fast-tracked.
Mistrust with vaccines dates back to the history of the Tuskegee study, where the Black community was told they were receiving free health care, but instead acting as test subjects for a syphilis vaccination.
We've been mistreated, we've been exploited. We've been experimented on.
On Thursday, Governor DeWine announced a new campaign for minority outreach on vaccine education. So I reached out to local minority leaders on what they wish to see out of this new campaign.
The more we can educate people and make sure we have the resources and information and make sure they're armed with the facts.
McNair and Banks hopes the campaign educates minorities with the help of local and statewide leaders.
We see people that look like us or people that we can trust, sort of an endorsement of the vaccine.
We need to target messengers in various communities like myself, those who are trusted voices that look like the individuals that they're talking about.
The Youngstown Public Health Department agrees it's beneficial to use local leaders as influencers. They added the minority outreach campaign should focus on utilizing social media, TV, and radio to spread information on the vaccine.
A one-pager just to give you information, and then maybe giving you a website so that you can go in and do a search yourself.
We want to live better, we want to live well, and we really depend on our leaders, formal and informal, at all levels, to have that heart of let's really get it done well, and we can get it done right.
I reached out to the state to find more information about the outreach initiative, and they can't provide details at this time. With more local news, I'm Aaron Simonek.
Sparkle.